This month marks Sober October, when people really around the world take a break from booze. And rumors are swirling this morning that the U.S. government could soon update its federal guidelines to say that no amount of alcohol consumption is safe for our health. Joining us now, I have Erlinda Doherty, former Director of Communications and Education for the Mezcal Institute. She's also worked for and advised organizations like Accenture, the U.S. Army, and the South Carolina Senate. Erlinda, welcome to the show. Thanks for being with me.
Thank you so much. Thank you for having me.
So I read your opinion piece in The Hill. You say that telling people no amount of alcohol is safe would be a drastic mistake. Why? What's your thought process here?
Well, I think what's lost in a lot of this debate is the social benefits that we get from enjoying a glass of wine or a cocktail. We are talking a lot about, post-COVID, how we've had this loneliness, epidemic and folks not being able to come together. And really, we're forgetting about that. We're forgetting about the social benefits, the conviviality, the conviviality that we receive from coming together to enjoy a glass of wine or a cocktail.
Yeah, I think so often when we hear about alcohol, based groups, we hear AA, we hear MAD. We don't hear about the women who whiskey, like that you brought up in your piece in D.C., who find community in it. I am curious, though, there are already existing federal guidelines from the National Cancer Institute warning that alcohol can lead to different types of cancer, studies that link alcohol consumption to heart disease. Do you believe those studies are inaccurate, or is this just more of a criticism of the zero alcohol stance?
Well, the science is unsettled. There have been hundreds of thousands of studies on alcohol and health. In fact, and I believe that there isn't enough science right now to justify such a drastic change in the guidelines that we've been relying upon for about 30 decades now, which stated that one drink daily for women and 2 drinks daily for men were safe. So, and in fact, the Lancet Global Burden of Disease Report, which is considered the gold standard of scientific studies in 2022, actually concluded that alcohol can be safely consumed by most adults. And it also states that in healthy adults over the age of 40, a small amount of alcohol could actually reduce the risk of cardiovascular disease and strokes. But my whole point here, again, as you mentioned, I'm the president of the DC chapter of the Women Who Whiskey Club, which is a global organization of women that come together to enjoy the craftsmanship of spirits, is that we're really just ignoring the joy of spirits that happens when we come together to do this. And it gives us an opportunity as women to share our aspirations, our careers, what's going on with our families. Yeah. So it's more so about bringing people together. And I think that changing these guidelines based on, science that's not settled would be a drastic mistake.
I also think about, messaging for kids who are told when something's labeled bad or unsafe, they want to experiment with it. We'll see what messaging looks like once it's finalized. Erlinda, thank you so much for joining me on Morning in America. Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.